Waiipi Snaxil in Cha Isquis, Cha Kukusint. Many of you know me as Lisa Montgomery-Reid. I'm the VPRO of the Interior Region. Work in partnership with our 7 nations, and I'm here to talk about our annual report, some of the highlights this fiscal year. So our focus has always been how do we support community on the ground. Many of you have been impacted by the findings of our missing children, de Kamloops, Secwepemc, St. Joseph's Mission. And we walked alongside of the hard work that the leadership has provided. They continue to lead the way, and that's been a huge trigger within our region. So we've done a lot of traditional wellness, a lot of mental wellness, have had a handful of First Nations clinicians supporting our communities. The foundation of our 7 nations is really around nation rebuilding. And now our nations talk about nation revitalization of how we carry out our work in a financially responsible and equitable way. On the ground, we support our communities, including navigating an ever-changing political and social landscape in order to best support our chiefs and our health directors. Our process is always aligned by honoring our nation and our community governance structure. We're very lucky that we're nation-based in our interior region, and that we recognize our nations as those title and rights holders always, and take their guidance and the work that we do. So I just wanted to talk a little bit about the highlight for this year for our regional team, and it really was about our caucus, our first in-person caucus. And our Interior Region Nation executive really thought it was important for us to uphold our nations and recognize them for the work that they've done on the front lines. With our wildfire, we've our atmospheric rivers, some of our members haven't been at home for over a year. Our Lit First Nations members, Okanagan Indian Band, Shaken, it's been a lot for our people. And so we had the opportunity to share our protocol of presenting staffs to each of the 7 nations. And it was unbelievable to do that, because our teachings are around those staffs carrying out the work of our ancestors, for that work to continue with those staffs going back to each nation. I also want to talk a little bit now about the work of our health directors and our nations with primary care. Our landscape has changed. Our landscape has changed with primary health care. And there's been a lot of pressure put on our health directors on top of COVID and on top of our EOCs in terms of negotiating sustainable resources, primary care resources closer to home. And so there's been some bumps in the road with that, but we've seen nurse practitioners at our health centers. We've seen increase of dietitians and navigators, traditional wellness workers at our health centers. And that's been amazing. On top of that, FNHA has been able to negotiate these FNPCI projects. Who would have ever known we're going to have our own primary care center in Williams Lake? It's thanks to our nations working in partnership, so we can pool our resources so our nations can walk into the center and it's theirs. It's all owned by our 3 nations. And our health directors, we have a 76% vaccine rate for our COVID vaccine, and administered and managed by our health centers, which is phenomenal. We also have our nation shared services, and I always want to have a shout out to our nations in terms of our end-to-end review and clearly articulating what you need to have to be successful. And without our nations and our community health directors and nurses and our chiefs, we wouldn't be able to do the work we've done. So now I want to talk a little bit about the challenges. And we have still been impacted by 20 wildfires in community. whether on alert or evacuation this year. We still have communities that are still not in their homes, and our chiefs are still continuing to do the hard work and advocate for their communities in such a unimaginable circumstance. So I just wanted to take a moment just to recognize them and the leadership that they continue to have shown us in this horrific time. Our opioid impact increase has been 35%. We've had a 35% increase in overdose in our communities, and we hear it. We hear from our leadership the amount of funerals that people are going to. One of the other pieces of work that we have done in support of our nations is around primary care. We have had all of our communities impacted by the primary care networks and have pulled together all of the challenges you have identified to us in terms of policy, in terms of access, in terms of equity. We're here to continue to support and advocate. We've heard loud and clear from our chiefs is that we want sustainable, flexible resourcing for you to do what the priorities are as identified by your nations. Also, continue to align and coordinate those services as those gaps in services and advocate for those gaps. So we're here and just highlighting a couple of things, and please refer to our annual report. There's a lot more detail in those reports, as well as our reports that we present at our caucus. Thanks for your time today. White Limblom.